Hello, everyone, and welcome to Small Talk Podcast. My name is Emily, and I'm so excited to be here with you today. How is everyone doing?
Hey there, Emily. I'm doing fantastic. Thanks for having me on the show today. It's always a pleasure to be here.
Robert, I'm thrilled you're here. Today we have a really important topic to discuss. We're talking about going to the doctor. This is something that everyone needs to do from time to time, right?
Absolutely, Emily. Going to the doctor is such an important part of taking care of ourselves. But I know many English learners feel nervous about it because they're not sure what to say or how to communicate their health concerns.
That's exactly why we're here. Today, we're going to teach everyone how to talk about going to the doctor. We'll cover everything from making an appointment to describing your symptoms to understanding what the doctor tells you.
And that's going to be really useful for anyone traveling abroad or living in an English-speaking country. These are practical conversations you'll actually use in real life.
Exactly right. Before we dive in, I want to introduce our vocabulary expert, Marcus. Marcus will help us break down the key words and phrases after each section. Marcus, are you ready to help us today?
Marcus is fantastic at making vocabulary clear and easy to remember. We're lucky to have him here with us.
Now, let's start with the first part of our lesson, making an appointment with a doctor. Robert, can you tell us how you usually make a doctor's appointment?
Sure, Emily. When I need to see a doctor, the first thing I do is call my doctor's office. I dial the phone number and wait for someone to pick up. Usually a receptionist answers the call.
And what do you say when the receptionist answers? Walk us through that conversation, please.
Well, I usually say something like, "Hello, I would like to make an appointment with the doctor." The receptionist will ask me some questions about my availability and what the appointment is for. I might tell them I have a headache or a sore throat or any other health issue I'm experiencing.
That's very helpful information. So when you arrive at the doctor's office, what happens next?
When I arrive, I check in at the reception desk. I give them my name and tell them I have an appointment at a specific time. They usually ask me to fill out some paperwork or forms.
What kind of paperwork do they give you? Is it complicated?
It's actually not too difficult. They give you a medical form where you write down your name, address, and phone number. You also list any medicines you're taking and any allergies you might have. This information is important for the doctor to know.
That makes complete sense. Allergies are especially important information. After you fill out the paperwork, what happens next?
You return the paperwork to the receptionist and then you sit in the waiting room. You wait until the doctor is ready to see you. Sometimes you have to wait a long time and sometimes it's quick.
I know many people get nervous in the waiting room. Robert, do you get nervous before seeing the doctor?
Sometimes I do, Emily, but I try to stay calm by taking deep breaths or reading a magazine. It helps me relax while I'm waiting for my appointment time.
That's a great tip. Now, Marcus, let's break down the vocabulary from this section. Marcus, can you help our listeners understand the key words?
Yes, Marcus has some really useful vocabulary for us. Let's see what he's got.
Now, let's move on to the second part of our lesson, describing your symptoms to the doctor. Robert, when the nurse or doctor calls your name, what happens next?
The nurse calls my name and I follow them to an examination room. In the examination room, the nurse takes my vital signs. That means they check my temperature, blood pressure, and heart rate.
What do those vital signs tell the doctor about your health?
They give the doctor important information about how your body is functioning. If your temperature is high, it means you might have a fever. If your blood pressure is high, it might indicate stress or other health concerns.
That makes complete sense. So after the nurse checks your vital signs, the doctor comes in, right?
Yes, the doctor comes into the examination room and greets me. The doctor asks me, "What brings you in today?" This is my opportunity to explain my symptoms.
How do you describe your symptoms clearly to the doctor? What words do you use?
I try to be specific and clear. For example, I might say, "I have a bad headache on the left side of my head. The pain started yesterday morning and it's been getting worse. I also feel tired and dizzy."
Those are very specific details. How long have you had this headache?
I've had it for about a day now. Sometimes doctors ask you about the duration, so it's important to remember when your symptoms started. This helps the doctor understand if it's a serious issue or something minor.
Do doctors ask you about other things related to your symptoms?
Yes, they do. They might ask questions like, did anything happen before the symptoms started? Have you eaten anything unusual? Are you taking any new medicines? These questions help them figure out what's causing your problem.
That's really informative, Robert. What if the pain is really intense? How do you describe that?
Good question. You can say, I have severe pain, or the pain is very intense. You can also use a pain scale from 1 to 10. You tell the doctor, my pain is about an 8 out of 10. That helps them understand how serious your symptoms are.
That's a helpful way to communicate. Marcus, let's pause here so you can teach us the vocabulary about symptoms. Can you help us with these important words?
Marcus is going to give us some excellent vocabulary now. This is the part where things really come together for our learners.
Let's continue with the next section, understanding the doctor's examination. Robert, after you describe your symptoms, what does the doctor do?
The doctor performs a physical examination. They might use a stethoscope to listen to your heart and lungs. They check your ears, nose, and throat. They might also ask you to stick out your tongue and say, ah.
What is a stethoscope exactly? Can you explain that for our listeners?
A stethoscope is a medical instrument that doctors use to listen to sounds inside your body. They place the earpieces in their ears and the other end on your chest or back. This helps them hear if there are any problems with your heart or lungs.
That's really clear. Do doctors usually tell you what they're doing during the examination?
Good doctors do. They say things like, I'm going to listen to your heart now, or this might feel cold. They communicate with you throughout the examination so you don't feel scared or surprised.
That's reassuring. After the physical examination, do doctors sometimes order tests?
Yes, they might. Depending on your symptoms, the doctor might order blood tests or other diagnostic tests. They might also take an X-ray if they think there's a problem with your bones.
Can you explain what a blood test is? Some learners might not know.
A blood test is when a nurse takes a small sample of your blood using a needle. They take the blood from your arm and it doesn't hurt much. The blood sample is sent to a laboratory where they check it for infections or other health problems.
Are many people nervous about blood tests?
Absolutely. Many people are afraid of needles, so blood tests make them nervous. But it's usually very quick and the needle is small. The nurse is trained to be gentle and make you comfortable.
That's helpful to know. Now let's hear from Marcus again. Marcus, please give us the vocabulary for this section about medical examinations and tests.
Marcus is going to break down some really important medical vocabulary now. Pay close attention, everyone.
Now let's move to the fourth section, the doctor's diagnosis and treatment plan. Robert, after the examination and tests, the doctor comes back with results, right?
That's right. The doctor sits down and talks to me about what they found. They explain my diagnosis, which is the name of what's causing my symptoms. Sometimes it's something simple like a common cold, and sometimes it's more serious.
How does the doctor explain the diagnosis to you?
They use simple language that's easy to understand. For example, they might say, you have a bacterial infection in your throat. This is causing your sore throat and fever. We can treat this with antibiotics.
What are antibiotics? Can you explain that?
Antibiotics are medicines that kill bacteria and help you get better from bacterial infections. The doctor usually prescribes antibiotics by giving you a prescription, which is a paper that you take to the pharmacy to get the medicine.
Do doctors give you instructions about how to take medicine?
Yes, they do. They tell you how many times per day to take the medicine and for how many days. For example, they might say, take 1 pill 3 times a day for 10 days. It's important to follow these instructions exactly.
What if you don't understand the instructions?
You should always ask the doctor to explain again. Say something like, I don't understand. Can you explain this more slowly, please? Good doctors are patient and want you to understand your treatment.
That's excellent advice. Do doctors tell you about possible side effects of medicine?
Good doctors do. They might say, this medicine might make you drowsy, or it might upset your stomach. If you experience serious side effects, call us immediately. This helps you know what to expect.
That's really important information. Now, Marcus, can you help us with the vocabulary from this section about diagnosis and treatment?
Marcus is back again with more essential vocabulary. This is really helpful for understanding doctor visits.
Now let's talk about the fifth section, asking questions at the doctor's office. Robert, should patients ask questions during their visit?
Absolutely. Doctors expect patients to ask questions. It's actually very important. Asking questions shows you care about your health and want to understand your condition better.
You can ask, how long will it take for me to feel better? You can also ask, when should I come back for a follow-up appointment? Another important question is, are there any foods or activities I should avoid while I'm recovering?
Those are really good questions. What if you want to know about alternative treatments?
You can definitely ask about that. You might say, are there other ways to treat this condition besides medicine? The doctor will explain different options available to you.
What about questions regarding cost or insurance?
That's a practical question. You can ask, how much will this treatment cost? Or, does my insurance cover this medicine? The staff at the doctor's office can help answer these questions.
That's really helpful information. Marcus, let's get the vocabulary for this section about asking questions.
Marcus is ready to help us again. Keep listening for those important words and phrases. Now let's discuss the sixth section, the prescription and pharmacy visit. Robert, after the doctor visit, you usually need to go to a pharmacy, right?
Yes, Emily. The doctor gives you a prescription and you take it to the pharmacy. The pharmacy is where they prepare your medicine. You can find pharmacies at hospitals, drugstores, or dedicated pharmacy locations.
What happens when you give the prescription to the pharmacist?
The pharmacist is the person who works at the pharmacy and knows all about medicines. When you give them the prescription, they look it up in their computer. They prepare your medicine and put it in a bottle with a label.
What information is on the label?
The label has your name, the name of the medicine, the strength of the medicine, and the dosage instructions. Dosage means how much medicine you should take. It also lists possible side effects and any warnings.
That's very detailed. How long does it usually take to get your medicine from the pharmacy?
It depends. Sometimes it takes 15 minutes, sometimes it takes an hour or more. If it's a common medicine, they might have it ready quickly. If it's a special medicine, it might take longer.
Can you ask the pharmacist questions about your medicine?
You absolutely should. You can ask, should I take this medicine with food or on an empty stomach? You can also ask, what should I do if I forget to take a dose? Pharmacists are very helpful and knowledgeable.
That's wonderful advice. Marcus, please give us the vocabulary for the pharmacy section.
Marcus is coming back with more vocabulary. This section is really practical for everyone.
Now let's move to the final section, emergency situations and when to see a doctor. Robert, what should you do if you have a medical emergency?
If you have a medical emergency, you should call emergency services. In the United States, you call 911. In other countries, there are different emergency numbers, but you can usually find them easily.
What counts as a medical emergency?
A medical emergency includes things like severe chest pain, difficulty breathing, loss of consciousness, or serious injuries from accidents. If you're unsure whether something is an emergency, it's better to call and ask the operator.
What happens when you call emergency services?
A dispatcher answers the phone and asks you questions about your emergency. They might send an ambulance to pick you up. An ambulance is a special vehicle with medical equipment and trained paramedics who can help you on the way to the hospital.
Are there situations where you should see a doctor but it's not an emergency?
Yes, absolutely. If you have mild symptoms that last more than a few days, you should schedule a doctor's appointment. If you have a fever that doesn't go away or persistent pain, that's a good reason to see a doctor.
What if it's during the night or weekend and you need medical advice?
Many doctor's offices have an after-hours line where you can leave a message. There are also urgent care clinics that are open outside normal business hours. Some people also call their local pharmacy for advice on minor health issues.
That's really practical information. Marcus, let's get the vocabulary for this emergency section.
Marcus is going to help us with emergency vocabulary. This is important to know.
Well, Robert, we've covered so much ground today. We talked about making appointments, describing symptoms, understanding examinations, getting diagnoses and treatment plans, asking important questions, visiting the pharmacy, and handling emergencies.
It's been such a comprehensive lesson, Emily. I think our listeners now have the language they need to confidently communicate with doctors and healthcare professionals.
A huge thank you to Marcus for breaking down all the vocabulary and making it clear for everyone. We really appreciate your help today.
Marcus has been absolutely fantastic. These vocabulary lessons really help everything stick in people's minds.
To everyone listening, remember that going to the doctor is an important part of taking care of yourself. Don't be nervous about speaking English at your doctor's appointments. Healthcare professionals understand, and they're there to help you.
That's absolutely right. Keep practicing these phrases in conversations. The more you practice, the more confident you'll become. Your health is so important.
We really hope this episode was helpful for you. Keep building your English skills and don't hesitate to communicate with doctors and healthcare providers. Your health matters.
That's all for today's episode of Small Talk Podcast. Thank you so much for listening. We'll see you next time with another useful English learning topic.
Keep practicing, stay healthy, and we'll talk to you very soon. Goodbye, everyone.
Goodbye and take care of yourselves. See you next time on Small Talk Podcast.